bridge toll expected to double come March. This as major refurbishments to start on the Eastern Bridge. Stakeholders now reportedly more engaged on NHI, plus 2 airport employees charged with drug-related offenses. We've got those stories and much more tonight. I'm Kyle Joaquin, and NB12 starts now. Topping news tonight, come March 1st, motorists will have to pay $2 to transit the Paradise Island Bridge, double the current $1 private motorists pay. The announcement came this morning during the contract signing for refurbishment for the Eastern Bridge, where officials detailed the work to be done, how long it will take, and the cost for the price hike.
As a consequence, effective March 1st, 2016, the tolls will be increased to $2 for private vehicles.
It comes towards the end of remarks made by Bridge Authority Board of Directors Chairman Rory Higgs. The announcement that private motorists in just over a month would have to pay double the amount to drive from Nassau to Paradise Island. The increase comes as Islandside Development, a Bahamian company, is awarded a contract to refurbish the Eastern Bridge. According to Higgs, the increase was unavoidable.
Our market research has shown that even with the increase, the new toll amounts with still a significantly lower than the tolls for similar operations throughout the region.
The work is set to cost just over $5 million. Labor Minister Shane Gibson explained how it will be funded.
Funding was provided through a private placement with the Central Bank of the Bahamas. In order for the Bridge Authority to meet this obligation to the bondholders, its board of directors recommended a toll increase, which is scheduled to take effect, as was said already, on March 1st, 2016.
Through technological advances, we have progressed from using tokens to paying a bridge toll, and paying a bridge toll to now being able to use smart cards, transponders, and cash coins. I'm also advised that many of the Paradise Island residents and employers enjoy the benefit of having a preferred lane that provides a more, I suppose, efficient route of access to their properties.
The project is expected to employ 30 Bahamians during the construction work and is expected to take 42 weeks to complete. But as for when it will start,
I think we have a 2 or 3 week mobilization period, but we would like to start that as soon as possible, pending payment of funds.
Larry Trico, the president of Islandside Development, the company awarded the contract, said the bridge will meet its 50-year life expectancy next year in 2017. The refurbishment is expected to add an additional 28 years to its lifespan. Trico said the company won't be making the bridge any wider or any other major adjustments, just several fixtures. He also explained that only those who work directly under the bridge near the pile of material will be affected, as the majority of the work will be done overhead. Just last year, Bahamians were sent into a frenzy after a notice was released alerting the public of an 8-cent increase to the bridge toll as a result of value-added tax. But now that the toll is set to increase by $1, Bahamians went to social media to vent. One person wrote, 100% increase? The Bahamas is quickly becoming a place that is out of control. Who can afford to live here? Another wrote, I could barely afford the dollar. Well, according to the Labor Minister, the increase is inclusive of value-added tax.
Let me just say that those toll amounts are VAT inclusive. It will be the first increase in more than 15 years and will cover costs to maintain both the eastern and the western Sydney-Poitiers bridges.
So with the price hike of 100%, where does this leave the thousands of people who make the trek over the bridge at least 5 days a week for work? We spoke with Ed Fields, Senior VP of Public Relations at Atlantis, the resort which employs thousands of Bahamians on Paradise Island. This was his take on the price hike.
Well, we meet half the cost of our employees' bridge tolls, but we're going to really have to look at, we just learned about this today, we'll really have to look at the impact that this will have on the organization. But we already through, we essentially we already subsidize bridge tolls for employees.
Now, to put things into perspective, if you're an employee working 5 days a week, come March, you'll be paying $10 for the week. That would run you up to as much as $40 monthly. Fields noted that no business enjoys raising fees, but he said it's a part of running a business in the 21st century.
You know, listen, costs go up. That's the reality. But at the end of the day, it will have impact on our bottom line, and so we'll have to see how we manage that situation. No one welcomes, I think, in any environment, costs going up, but it goes up, and then you have to contend with how you deal with that.
Well, in the wake of local doctors voicing wide-range concerns over national health insurance and warning they won't sign onto the scheme unless their concerns are addressed, NHI Secretariat Project Manager Dr. DeLon Brennan said the Secretariat has enhanced its stakeholder consultations, specifically with doctors, and they've become more engaged with the process. Brennan said as much today during a press conference hosted by the Secretariat where they gave more specifics about the plan. Dana Smith reports.
Now, private sector doctors have voiced concerns over NHI implementation, but NHI Secretariat Project Manager Dr. DeLon Brennan said the Secretariat met with local doctors as recently as this past weekend, and it's getting to a point where local doctors feel more comfortable.
I don't think that it's a concern for us that they are not going to sign on to the program, because as it was stated for them, it wasn't that they don't want to sign on to the program. They're engaged and they want to be a part of it. What they want is more information from us, but they also want to feel as though their concerns and their needs are being addressed as a part of designing the NHI program. And again, through our consultations with them, even as late as this weekend, they have been able to voice some of those concerns. We have shown how we can modify the original models to address those. So I think we're actually getting to a point where they feel more comfortable with what we are going to start out with.
Dr. Brennan's comments come after the Medical Association of the Bahamas said a toxic political environment and a lack of education have contributed to a very large information gap. The Consultants Physician Staff Association accused the government of ignoring and marginalizing the views of local doctors. And the Bahamas Doctors Union said morale among doctors is low, and the union has a number of concerns, among them a lack of suitable communication, transparency, and appropriate consultation. Brennan was speaking at a press conference this morning where the NHI Secretariat gave more details about the Christie administration's ambitious plan to introduce universal health care coverage through NHI, which will be implemented in 5 phases. The registration process is currently underway and will be followed by enrollment and then primary care by April. Primary care includes doctor's visits, prevention services, diagnostics, and medication, with no cost at point of service and no new tax being imposed. Government will foot the bill to the tune of $25 million from April until June.
To paint a picture for you, a pregnant mother will be able to get an ultrasound to check on her unborn child without having to pay for it. Those at risk for diabetes can have a screening done free of charge. You can go to your primary care doctor for an annual checkup without having it impact your bank account. All health costs for primary care services will be paid for the government of the Bahamas through general revenue collected by the Ministry of Finance, commonly referred to as the Consolidated Fund. It is estimated that the primary care phase of NHI Bahamas will cost the government approximately $25 million from April until June, and will be tracked and forecasted each quarter thereafter, based on utilization rates and cost saving.
As for how the Secretariat came up with that $25 million figure, Brennan said no one's absolutely sure about final costs, but they've been able to do estimates for the initial start of the plan. According to one official, the number is based off factors like what people are paying now for doctors' visits, what the Department of Public Health is spending, and what government spends as a part of the prescription drug plan.
As you can imagine, at the very beginning and at the outset of this, no one's absolutely sure at what final costs will be, but we have been able to estimate what we think the Bahamas government will be able to provide in order to address those circumstances. And as we have gotten those numbers together, we have been able to provide some estimation to start us out on that journey. But as I stated, that is only an estimation for starting. What we do know is as we see what the utilization rates are going to be and what services are needed, then we can go back and renegotiate what those amounts are going to be, so that we'll be able to roll out the types of funding and the types of services that are going to be necessary to address the needs of the Bahamian population.
There is no timeline set for the other phases of NHI implementation, select catastrophic coverage and full benefits coverage. And according to the Secretariat, at least 60% of Bahamians would support a payroll deduction to help pay for NHI. Brennan said approximately 70% of Bahamians do not have health insurance, and 32% of that figure have, at some point, needed medical treatment but did not seek help because they were worried about the cost. NHI Bahamas, he said, will change all of this. To ensure the public has all the information it needs on NHI, the Secretariat has launched a website, www.nhibahamas.gov.bs. Also, the draft legislation to govern NHI will be released soon. Brennan said communication with stakeholders is extremely important. To that end, another round of consultations will start next month. Officials also stressed today, in order to access free health care, you will need an NIB Smart Card. Those with private health insurance are also encouraged to register. And once the enrollment phase begins, those enrolled will select a healthcare provider from a list of physicians who have registered for NHI. The Secretariat said negotiations with doctors with regard to registering are ongoing. Reporting for NB12, I'm Dana Smith.
In news from the courts, several men were arraigned in the magistrate's court this morning for drug possession in two separate incidents. Over the weekend, police arrested two Linden Pendling International Airport employees in connection with the discovery of 4.5 ounces of cocaine. And last week, police arrested a man from Exuma after they seized a large quantity of drugs on board a mailboat. Simone Davis was in court during the arraignments and filed this report.
28-year-old Cordero White, seen in the tan T-shirt, and 38-year-old Alex Turnquest, seen in the black jacket, were arraigned in magistrate's court this morning before Magistrate Andrew Forbes. The pair was charged with possession of dangerous drugs with the intent to supply and conspiracy to possess dangerous drugs with the intent to supply while concerned with others. On Sunday, police reported that two Linden Pendling International Airport employees, one of them a supervisor, were arrested in connection with the discovery of 4.5 ounces of cocaine. According to the police report, at around 1 p.m. on Friday, Airport Authority security personnel, after conducting a routine search of a water truck, an employee was operating near the entrance of the ramp of the airport. Police then arrested that employee. Superintendent Samuel Butler confirmed that a second employee was arrested in connection with the matter on Saturday. Both White and Turnquest pleaded not guilty to both charges and were remanded to the Bahamas Department of Corrections. Magistrate Forbes also alerted the men that their charges were not bailable and they were allowed to apply for bail at the Supreme Court. He also noted that the matter would proceed to trial and the men were to return to court on April 12. Also in court today, 39-year-old Jermaine Smith of Smith's Manor, Exuma, seen in the yellow button-down shirt, was also charged with possession of dangerous drugs with the intent to supply. The stipulations were that around 11 a.m. on January 21st, a team of police officers from the Drug Enforcement Unit, acting on information, conducted a search of a mailboat moored at the Potter's Key dock that had just arrived from Exuma. They then seized 3 boxes of marijuana on board, equivalent to 57 pounds. Later that week, Smith was taken into custody. Smith initially pleaded guilty to the charge. The prosecution proceeded to read the details of the incident, adding that after Smith was arrested, he was transferred to New Providence, where he acknowledged that drugs were in the boxes that was labeled for a man named Emerald Johnson, who was supposed to collect it once it arrived in New Providence. Smith told the magistrate that he did not agree with those facts, and Forbes informed him that he would then have to record a not guilty plea. Smith was denied bail and remanded to the Bahamas Department of Corrections, and the matter was adjourned until April 7th at 10 a.m. From the Magistrates Court for NB12, I'm Simone Davis.